I'm sure there's some questions, but Obamacare came in with all this fanfare and all this promise. Remember, if you like your plan, you can keep it. That was proven the lie of the year at the time. Remember, it was going to lower premiums $2,500? They've skyrocketed since then. Remember, you're going to have all these choices. 5 states, you only have one choice. 31% of all the counties in America, one choice. That's not a choice, that's a monopoly. And the problem is the premiums are going so high, the deductibles are getting even higher, the law is collapsing. And so we've got to rescue people from the collapsing of this law and fix this problem. And so that's what I'd love to engage in. I know you've got questions, so I don't want to.
Yeah, no, let's get up and let's.
But I think there's a lot we can do to improve this problem.
You just mentioned pre-existing conditions. Let me introduce you, and please get up because I know you want to engage. Jeff Jeans is from Sedona, Arizona. He was a lifelong Republican, and then something happened. Jeff,
come back.
I was a Republican, and I worked for the Reagan and Bush campaigns. Just like you, I was opposed to the Affordable Care Act. When it was passed, I told my wife we would close our business before I complied with this law. Then, at 49, I was given 6 weeks to live with a very curable type of cancer. We offered 3 times the cost of my treatments, which was rejected. They required an insurance card. Thanks to the Affordable Care Act, I'm standing here today alive. Being both a small business person and someone with pre-existing conditions, I rely on the Affordable Care Act to be able to purchase my own insurance. Why would you repeal the Affordable Care Act without a replacement?
Oh, we wouldn't do that. We want to replace it with something better. First of all, I'm glad you're standing here. I mean, really, seriously.
Can I say one thing? I hate to interrupt you. Can
I
say one thing? I want to thank President Obama from the bottom of my heart because I would be dead if it weren't for him.
You mentioned you come from Arizona?
Sedona.
Sedona, sure. Our old city manager from Janesville is the city manager down in Sedona now.
My family's originally from Janesville.
Really?
Yes.
What's your last name again?
Jeans, like Blue Jeans. Kraft was my grandfather's.
Oh, okay. Yeah.
They're buried there, actually.
So, okay, we digress here. Sorry. Arizona, this year, the premium increases for people on Obamacare, 116%. Oklahoma, 69%. Tennessee, 63%. Minnesota, 59%. The problem is these increases were double-digit last year. They're really high this year. This thing's collapsing. So do we want to make sure that a person like yourself with a pre-existing condition gets affordable care? Of course. Of course. There is a better way to fix that problem without giving everybody else all these massive premium increases. The deductibles are so high, it doesn't even feel like you got insurance anymore. So obviously, I would encourage you to go to our website and take a look at our plan, but let me just give you a few ideas. We believe that state high-risk pools are a smarter way of guaranteeing coverage for people with pre-existing conditions. We had a really good one in Wisconsin. Utah had a great one. I was talking with a congresswoman from Washington today who was telling me how good their state high-risk pool is. What I mean when I say this is about 8% of all the people under 65 have that kind of pre-existing condition. My mother-in-law, cancer, she had melanoma in her 20s, breast cancer in her 50s, ovarian cancer in her 60s. People just have these things. And we don't want people to go poor or bankrupt because this thing happens to them. So we obviously want to have a system where they can get affordable coverage without going bankrupt because they get sick. But we can do that without destroying the rest of the healthcare system for everybody else. That's the point I'm trying to make. What we should have done was fix what was broken in healthcare without breaking what was working in healthcare, and that's what, unfortunately, Obamacare did. So, by financing state high-risk pools to guarantee people get affordable coverage when they have a pre-existing condition like yourself, what you're doing is you're dramatically lowering the price of insurance for everybody else. So if we say, let's just as taxpayers, and I agree with this, finance the coverage for those 8% of Americans under 65 in a condition like yours, they don't have to be covered or paid for by their small business or their insurer who's buying the rates for the rest of the people in their insured pool, and you dramatically lower the price for the other 92% of Americans. Let's just directly fix that so that everybody else can get more competitive rates and they don't have to pay for insurance to try and cover for those kinds of really expensive people. The problem with Obamacare, the actuaries call it a death spiral. It's a really kind of ugly, gruesome term. But a death spiral is a mathematical term. They say when the insurance gets so expensive, healthy people won't buy it because it's just a trade-off. The penalty to not buy it is a lot cheaper than buying the insurance, so healthy people won't buy it. Therefore, they won't go and participate in the insurance pool to cover the losses that sicker people who have to have insurance buy it. That's what's happening to Obamacare now. So you have unhealthy people more buying it, healthy people not buying it, and that is why the rates are going up so much. That's why all the insurers are pulling out. Biggest health insurance company in the country last year, United, pulled out of Obamacare. Aetna pulled out of Obamacare. Humana pulled out of Obamacare. As I mentioned, 5 states now are down to 1 insurer. Over 1,000 counties in America are down to 1 insurer, and they're all getting double-digit premium increases because they have a monopoly. So clearly that's not working. And we see the worst is yet to come. The insurers are telling us they're going to pull out of whole states now. So we've got to step in front of this problem because as Republicans, we could just say, I think the president-elect said this yesterday, we could just sit back and watch it all happen and say, oh, look at what the Democrats did. That would be irresponsible for us to do that. So we have to step in and rescue people from the collapse of this law. There are good objectives that they sought to achieve in this law. We agree with that. We think young people should be able to stay in their parents' plan until they're 26. We think there needs to be a solution, which we have, for people with pre-existing conditions. But we want more choices, lower prices, more competition, no monopolies. That's what we want to replace it with, and that's what we're working on right now.
So I'm sorry to interrupt. So there are other questions about Obamacare, and I want to let you get to them. But just to put a point on this, one of the things that Jeff was asking about is you've begun the process of repealing Obamacare. Is the process of replacing it going to coincide with it?
Yes.
It's going to coincide.
Yes. So without getting into all the little legislative mumbo-jumbo, we want to do this at the same time, and in some cases in the same bill.
Okay.
So we want to advance repealing this law with its replacement at the same time along the lines of what I just described, because I said people just aren't buying insurance. Or if you get it, your deductible is so high, your out-of-pockets are just so unaffordable, people aren't going to doctors. And so we've got to fix that problem. And the point I keep making, in America, we spend more money than anybody else on health care. Surely we can have a system that works for all of us.
Thank you, Jeff. And I know you speak for a lot of people, so thanks for being here tonight.
Come visit us in Janesville.
I want to introduce
maybe not in January. It's pretty cold.
I want to introduce you to Dawn Jones. She's an administrative officer with the U.S. Navy. She's from Huntingtown, Maryland.
Thank you. As much as I'm for affordable child care or health care, I don't think Obamacare is hitting the mark. For example, college-age children who are healthy are required to obtain health care,
right,
but they don't have the money to pay for it. So what can Congress do to help them get affordable health care or opt out of it for those who cannot afford it?
Yeah, so what's happening more and more these days, because Obamacare has become so expensive, are the younger, healthier people just aren't buying it, and they're just going without insurance. Because the part of the law that's also counterproductive in this way is you can wait till you get sick, then get the insurance without a penalty. And that's why they had this whole convoluted government-run system that's basically collapsing. What we believe is the right way to go, which is what our plan is, are refundable tax credits for people to be able to buy affordable coverage. And so by giving a person a refundable tax credit, a young person, maybe a person in college who maybe didn't stay in their parents' plan, or somebody just getting started in work that doesn't have much of a tax liability. When I say refundable, that means you get the tax credit regardless of whether you have an income tax liability or not, regardless of how much money you make. Today, the big tax subsidy in law is you get to, it's excluded from your income. So what we're saying is the person in the highest tax bracket, the highest income earners get the biggest tax break for health care, but that's not who are struggling to pay for health care. We want to make sure that we want to instead have tax credits so that everybody can have a shot at buying, take their tax credit and go buy a health care plan of their choosing. And that's the other thing. We don't want to make people buy something that they don't want to buy. We don't want to force them to buy all these different benefits. We want people to be able to get the coverage that they want, the choices that they want, the options that they want. And more importantly, we want competition. We don't want one insurer in one state. We want a lot of insurers competing against each other for our business as consumers. And this is the real big problem with Obamacare. They basically decided that they'd have the government run it, and now it's just a monopoly that is crashing. So what we want to do is make sure that anybody, young person, old person in between, gets a tax credit to go buy a plan of their choosing among a lot of choices that are competing against each other for their business. More competition means better quality and lower prices. We also think health savings accounts are a real key critical piece of this. Let people save tax-free for health care, or let employers or parents or whoever put money in a person's health savings account to help them with their out-of-pocket costs or their premiums.
So do you have a date for when you're going to repeal it and when you're going to replace it, or it's just going to happen this year?
Yeah, I don't have a date, but that's something we're working on right now, and it's going to take us a little bit of time, but we're working on this as fast as possible. Again, because we see this law collapsing even faster this year, because we see more insurance companies pulling out, people with little or no choices, and another round of double-digit premium increases, we really feel we need to step in and provide better choices and better options as fast as possible. So we're going to move on this as quickly as we can.
First 100 days?
Yeah, oh yeah, it's something, definitely is a plan within the first 100 days to get moving on this legislation.
I want to introduce you to Sherry Riggs from Fort Pierce, Florida, who didn't vote on Election Day because she was recovering from a heart attack. And we're glad you're here, too.
Thank you.
One point that I just want to make is that obviously, and this fits in with what you were saying about refundable tax credits, but also what you're about to be asked, which is the White House says that there are 8 million Americans who now have health insurance because of the Medicaid expansion. Medicaid was expanded in Obamacare in states that accepted that money. So are there a lot of people who are lower income who wonder what's going to happen to them, whether they're on Medicaid or not? Please.
Yeah.
Where are you from again?
Good
Sherry?
evening, Fort Pierce, Florida.
Florida. Okay.
Well, you want to give tax credits instead of insuring people. Now, what if a person makes?
Can I get you right there? It's tax credits to buy insurance.
Okay.
Yeah.
Well, what if a person makes so little that they don't have to pay taxes? Will they still have access to the federal? Or
that's what we were
health
trying to
care?
say here in this last question. So a tax credit, the way we describe it when we say refundable, that means you get it no matter whether you pay taxes or not. So it's like a voucher, basically, to go buy health insurance. And for Medicaid, some states do a pretty good job of Medicaid. Some states don't do as well. The problem that we're seeing in Medicaid is more and more doctors just won't take Medicaid because they lose money on Medicaid. It's so over-regulated and so bureaucratic that physicians just won't take Medicaid patients. And so our concern is that people on Medicaid can't get a doctor. And if you can't get a doctor, what good is your coverage? So we really think that there are a lot of good Medicaid reforms at the state level. There's some states that have done some pretty impressive things. Indiana is one state. Wisconsin, we've done some pretty good reforms to make sure that people of low income get good coverage, but also get access to care, actually get doctors that will take that care. We want to see more of those state-based solutions so that we can make sure that that coverage actually works. You're right on the numbers. About 10 million people got it on Medicaid. There are about another, I think, 11.5 million that got health care on Obamacare. Obamacare at this time was supposed to have 23 million people. So it's 11 million instead of 23 million. It's far missed its mark, but the problem is more and more people just are getting a plan that they can't use because their deductible is so high, or we have a Medicaid problem. So we want to reform Medicaid as well to make sure that states can innovate it so that it works for their citizens and so that they can actually get care.
Thank you so much. I want to. Part of your plan for repealing Obamacare is also to defund Planned Parenthood. I want to bring in Shannon Vo, who is a physical therapy graduate student here at GW, and wants to ask you about.
Where are you from, Shannon?
It's complicated. I moved here for graduate school, but I'm from Northern California.
Okay.
So among a lot of other things that we have heard in the news, Planned Parenthood also provides cervical cancer screenings, annual examinations, as well as other critical health care services. And I will continue, and I have used these services for the next 4 years. And I can tell you personally that Planned Parenthood provided help when I couldn't go to anybody else. So my question for you, Speaker Ryan, is if Planned Parenthood is defunded, then where will millions of women, low-income groups, and
it's a
like
good
myself
question. First of all, I want to make sure you get the care you need. We want to make sure that all women get the kind of care that they need, like preventative screening and services like you're talking about. We believe that this can better be done by putting that money in federal community health centers. Federal community health centers, I have a lot of experience with them myself. They're all throughout Wisconsin. They're in virtually every community. By putting these dollars in the federal community health centers, which provide the same kinds of services, for every Planned Parenthood, there are 20 federal community health centers. They're vastly bigger in network. There are so many more of them, and they provide these kinds of services without all the controversy surrounding this issue.
Can I just ask you, you believe in providing more choice for people when it comes to health insurance, except for Planned Parenthood?
Well, there's a long-standing principle that we've all believed in, and by the way, this is for pro-choice, pro-life people, that we don't want to commit taxpayer funding for abortion. And Planned Parenthood is the largest abortion provider. So we don't want to effectively commit taxpayer money to an organization providing abortions, but we want to make sure that people get their coverage. That's why there's no conflict by making sure that these dollars go to federal community health centers, which provide these services and have a vast larger network than these Planned Parenthood clinics, which are surrounded by a lot of controversy. And we don't want to commit people's taxpayer dollars to effectively funding something that they believe is morally unconscionable. Not everybody believes that. I understand that. But that's a long-standing principle we've had in this country that we want to maintain.
Of course, taxpayer dollars don't fund abortions right now, right? Because of the Hyde Amendment?
Because of the Hyde Amendment.
Right.
But they get a lot of money, and you know, money's fungible, and it effectively floats these organizations, which then use other money. You know, money's fungible.
A lot of...
You don't have this controversy by funding health centers.
A lot of people on social media want to ask you about Medicare and your plans for Medicare. Donald Trump, during the campaign, said about you, you want to knock Medicare way down. Mr. Trump said,
I wouldn't call it the most articulate description of my plan.
No, I'm going to let you respond.
Right. Sure.
He said, I'm not going to cut it, and I'm not going to raise ages, and I'm not going to do all the things that they, meaning you, want to do. Now, you say Medicare needs to be changed or it won't survive. What are you going to say to President-elect Trump to change his mind?
We've had a couple of conversations about it. Look, we don't all agree on everything. I think people kind of know that. Here's the issue with Medicare. More than half of the money going to Medicare right now is money we borrow. Medicare goes bankrupt in the next decade. Medicare, along with Social Security, are the two most important programs the federal government has, in my opinion. I mean, after my dad died, my grandma moved in with my mom and myself, living on Medicare and Social Security, battling Alzheimer's. I watched that program do amazing things for my own family. So know that we want to make sure that this program is successful. But if we want this program to succeed, we have to save it from the insolvency and the bankruptcy that's coming. And so the kinds of reforms that we've been pushing and talking about are reforms designed to save the program and give people more choices. And they don't affect anyone in or near retirement. And here's the thing. If we can improve Medicare for the next generation, for the Tapper-Ryan generation on down, we don't have to change the benefits for anybody in or near retirement. And we can continue to afford to cash flow that promise that's been made to them. But there is no way on the current path we are on, Medicare will be for our generation when we retire. So we better get prepared to fix this problem while it's so containable and solvable without affecting the benefits or the choices or the plans of people currently on Medicare, like my mom. And that's something that we have to just own up to in this country. It's the biggest part of the debt crisis in the future. And it is something that we have to deal with. And the point is, I think these reforms are better. I like the idea of saying to a future senior, if you like the traditional Medicare plan, you can keep that. But if you want to choose from a list of competing health plans that are comprehensive, competing for your benefit, that are guaranteed benefits, like federal employees have, you should be able to choose that too.
If you like your plan, you can keep your plan.
Yeah, and that's what premium support is. Yeah, nice, yeah. All right, gotcha. But that act of choice and competition, it's been proven to, you're going to hear this theme. It's been proven to drive down costs because it makes those insurers compete against each other for our business.